Hi, my name's Ellie and I'm a massage and sports therapist at Myofascial SA in North Adelaide, and today we're going to be talking about lateral epicondylitis and how to self-massage to treat the symptoms. Tennis elbow is generally a pain or discomfort on the lateral epicondyle, and it's caused by an overuse of the extensor muscles. So today we're going to go through some self-massage techniques to show you how to release off any pain or discomfort that you might be having with your tennis elbow injury. The lateral epicondylitis is an overuse or a trauma to the extensor muscles in the tendon near the lateral epicondyle. It produces pain right on the lateral epicondyle and can be worse sort of when you're using it or during sport, say tennis, or if you're working with it. So a lot of people who have jobs where they use their hands a lot, so carpenters and painters and things like that, can also get tennis elbow, so it's not just a sports thing. Pain will often be worse when we're using it, so when you're doing grip strength or holding onto something. Generally worse in the morning rather than the afternoon. It sometimes takes a little bit of time to warm up. So today we're going to show you a few self-massage techniques for the extensor muscles. We're going to use a little bit of myofascial release, trigger point therapy, and a pin and stretch, as well as some cross friction fibres. So we'll go through all of them individually and I'll show you how each and every one's done. So to start off with, we're going to do a little bit of myofascial release on the elbow. So most people know this as a Chinese burn, so it's just to warm up the area. So we're grabbing the skin, rotating over the top and warming it up. So don't grab too hard, it's just a warm up, grabbing and moving over the top. And we're going to work our way down the arm, moving outward over the arm. So you're going to do this for a couple of minutes just to warm up the area and get the blood flowing through the muscles. Come back up and go again. There you go. The next technique that we're going to use is a duck grip. So what you're going to do is holding the palm out, bend the elbow up, duck grip, grab on. We're going to roll over that lateral epicondyle and those tendons that are causing the main issue there. So rolling out and over and giving it a good squeeze all the way down. So work your way down the arm right through the extensors. Alright, the next technique that we're going to use is a trigger point release. So elbow up on the table, palm facing out, palm facing in. What we're going to do is hold on near that lateral epicondyle, find a tender spot with the fingers, pin it when you find that tender spot and sit there for a bit. Now this can be a little bit painful, but just try and hold on in there for a little bit. It should release off or feel lighter after a certain amount of time. Now you have an option to sit here and release it like this, or what we can do is pronate and supinate the wrist, and this will slowly loosen off. So it's a bit of a pin and stretch exercise. Just go easy and light to start with, and then get deeper into the muscle fibres as you start to work through it. Moving the fingers up and finding other tender spots. And now we're going to do a little bit of cross friction fibre. So cross friction fibre works across the direction of the fibres. So this breaks down any scar tissue that may be causing it to be less flexible or anything like that. So what we're going to do, thumb on the lateral epicondyle and move down slightly. So this area can be quite tender and you'll feel it'll be quite ropey. So coming in and just cross the fibre. So the fibre runs down this way and we want to massage over the top. Down and over. And do this for a good couple of minutes. This will break down any tissue that is causing the discomfort. With any tendinitis, we want the rate of repair to be greater than the rate of use. So this will help it repair a lot faster. Okay. Once you've done that for a few minutes, come back over the top with longitudinal frictions. This runs in the direction of the muscle fibre. So the main muscle that you're working on or will be working on today, or that causes the problem, is the Extensor Carpi Radialis Brevis. This muscle originates from the lateral epicondyle and runs down all the way through to the third metacarpal. So runs around and extends the wrist like this. Thanks for listening to my post today about lateral epicondylitis. If you do get any increased pain after self-massage or any amount of discomfort, please seek further medical advice from your physiotherapist or massage therapist. Thanks for listening.